Reading a patient's history and performing a physical exam may seem like a daunting task to a first-year medical student. But with the help of this video, and of course, Bates' Guide to the Physical Examination and History Taking, anyone can be a great doctor. Let's meet our medical students, John and Jane. First things first, let's check to make sure you have all the necessary equipment. Ophthalmoscope, otoscope, flashlight, ruler, tongue depressor, thermometer, watch, sphygmomanometer, stethoscope, gloves and lubricant, vaginal speculum, reflex hammer, tuning fork, Q-tips, safety pins, cotton, paper, pen or pencil. The initial moments of your encounter with the patient lay the foundation for your ongoing relationships. As you begin, greet the patient by name and introduce yourself, giving your own name. If possible, shake hands with the patient. Consider the best way to arrange the room and how far you should be from the patient. Avoid arrangements that convey disrespect or inequality of power, such as interviewing a woman already positioned for a pelvic exam. Now that you've established rapport, you are ready to pursue the patient's reason for seeking healthcare. Begin with open-ended questions that allow for full freedom of response. Use active listening skills. Lean forward as you listen. Add continuers such as nodding your head and phrases like, uh-huh, go on, and I see. Asking questions about sexual behavior can be life-saving. An orienting sentence is often helpful. To figure out why you have
this discharge and what we should do about it, we need to ask some questions about your sexual function. Are you sexually active?
Using the term sexually active can be ambiguous. Patients have been known to reply, no, I just lie there. When first examining patients, feelings of insecurity are inevitable, but these will soon diminish with experience. Be straightforward. Identify yourself as a student. Try to appear calm, organized, and confident, even when you feel differently. Examine arterial pulses, the heart rate and rhythm, and the amplitude and contour of the pulse wave. Most patients prefer oral to rectal temperatures. Temperature readings may be inaccurate, and thermometers broken by unexpected movement of the patient's jaws. To avoid alarming the patient, warn the patient ahead of time by, say, for example, I would like to spend extra time listening to your heart and the heart sounds, but this doesn't mean that I hear anything wrong. At times, you may discover abnormalities, such as an ominous mass or a deep oozing ulcer. Always avoid distaste, alarm, or other negative reactions. Place yourself 15 inches away from the patient at an angle of 15 degrees lateral to the patient's line of vision. Place the thumb of your other hand across the patient's eyebrow. Shine the light beam on the pupil and move toward the patient. Insert the speculum gently into the ear canal, directing it somewhat down and forward and through the hairs. You will acquire the art of draping the patient with the gown or draw sheet as you learn each segment of the exam. Your goal is to visualize one area of the body at a time. You may find that ending the encounter is difficult. Let the patient know that the end is approaching to allow time for the patient to ask any final questions. Make sure the patient understands the mutual plans you have developed. For example, before gathering your papers or standing to leave the room, you can say, we need to stop now. Do you have any questions about what we've covered? If you remember everything we've covered today, you'll be well on your way to becoming an excellent physician. And of course, if you ever find yourself in an awkward situation, turn to your trusty friend, Bates' Guide to the Physical Exam and History Taking.